In a world of Democrats,
there will be time for them to make profits. Now's not that time.
And Republicans.
I've abandoned free market principles to save the free market system.
You need a voice of liberty. Look no further. You've found it. Tom Woods. Beware, citizen. You are now departing from the world of allowable opinion. The Tom Woods Show.
Welcome, everybody. It's Thursday, September 18th, 2014. And we're talking Canada today. What's going on in Canada? What's the state of freedom in Canada? So I thought I'd bring on my old friend Redmond Weissenberger, who is the director of the Ludwig von Mises Institute of Canada. Mises.ca, that's Mises.ca, is the website. He founded the Mises Institute of Canada in 2010. He's also the managing editor of The Dollar Vigilante. We had Jeff Berwick on this program some time ago. And I'm delighted to bring him onto the program right now after reminding you guys that this program runs Monday through Friday. You get your daily serving of liberty education over at TomWoodsRadio.com, where you can find subscription links to iTunes and Stitcher so you don't miss an episode. And of course, you can get that free ebook of all the conversations we had on this show in 2013 on a wide variety of topics. It's a fun way to bring yourself up to speed on so many areas where you're going to have to defend yourself against friends, family, acquaintances, whatever. You can do that for free. You read that book for free, get it, put it on your Kindle, put it on whatever device you've got over at tomwoods.com/woodsbook. And there you go. You got your free ebook. All right, Redmond, welcome to the show.
Thank you very much, Tom. I've been a faithful listener and a long-time listener of your show. Absolutely.
Oh, long-time listener, first-time guest. Well, one thing you would have noticed as a long-time listener is that, unfortunately, for whatever reason on this show, we act as if there is no Canada. Canada does not exist. I wanted to rectify that today. There is a Canada. I have listeners in Canada. That's not the only reason I'm interested in Canada. I'm interested in it from a comparative standpoint. What kind of policies has Canada pursued as compared to the U.S.? And just in general, I'm curious to know what's going on there. There are a number of issues related to Canada I'd like to get your thoughts on, and then I want you to tell us a little something later on about the Mises Institute of Canada. First of all, let's talk about economic performance. Now, Canada, for some time anyway, was apparently engaged in getting its fiscal house in order in terms of spending, and wound up having fairly good economic performance in the years leading up to the financial crisis. Can you talk about that a little bit, and then we'll talk about what happened after the financial crisis?
Yeah, absolutely. So, when you go back to let's say the 1990s, Canada coming into the 1990s from the 1970s and 1980s, obviously we had racked up a large amount of debt, massive deficit spending. We were sort of on the same track as places like Sweden and the Nordic countries. Now, what happened was, especially at a certain point in the early 1990s, basically, the investors in New York City and around the world said, we're not going to buy Canadian bonds anymore, so you need to start cutting, right? So what happened was the Liberal government of the day actually stepped on the brakes. They started cutting the bureaucracy. They cut their budget. They lowered their budget deficits. We actually started running surpluses in about 2 to 3 years. The federal Canadian government started running a surplus. And what happened from there is, after the federal government cut, you had the provincial governments cutting as well. So they were getting their economic house in order. And subsequently, after the provincial governments cutting, you then had the city-level governments cutting. So all along the line, you had a reduction in the size of government. You also had lowering of things like corporate income taxes and these sorts of things, and a real turnaround in the economic performance in Canada, which really set us up in a lot of ways for a lot of years of good economic performance here.
So what happened after the terrible the downturn of 2008? Did the Canadian government say, well, it's kind of served us well to have government be less and less involved, so why don't we stick with that plan?
Yeah, well, unfortunately, that didn't happen.
No.
Yeah, of course it didn't happen. Now what's interesting about Canada, we actually have a long history of having surprise. I'm sure it'll come as a huge surprise to to people in the United States. But Canada actually has a long history of having a smaller government than the United States and less intervention. When you go back to sort of the late 19th century and early 20th century, of course, the Liberal Party that we have was founded as a classical liberal party, and they believed in smaller government, they believed in lower taxes, and they actually saw that as, they believed in free trade and these sorts of things, and they actually saw that as a way to have Canada improve, sort of be a better competitor. They would look down at the United States and see this, this sort of monumental power and say, well, how do we compete? We can compete by having lower taxes, a freer economy, free trade, open borders, all these sorts of things. Now, of course, over the years, the Liberal Party became sort of party of political expediency. But we do have that root there. Now, currently we have a conservative party that, the founder or the current leader of it, Stephen Harper, was a big fan of Hayek and Thatcher and these sorts of people. So he does know about the Austrian school. He does know about the benefits of free markets and lower taxes. But we also are sitting beside the United States, which is our largest trading partner. And, we have, people like to say that we have an independent central bank or we have an independent monetary policy. Well, of course, the Canadian government doesn't have an independent monetary policy from the United States because we have a lot of exporters. So what they like to do is keep the Canadian dollar trading within a certain band against the U.S. dollar. So I think what happened is that when the floodgates opened in the United States and the monumental amounts of printing that went on there, and interest rate suppression that went on there, essentially the Canadian government was forced to follow suit because they're not willing to, essentially have the pain of having a massive change in our exchange rates. There's no reason why Canada couldn't be sort of the Switzerland of North America, but for a variety of reasons, they're choosing not to do that. Now, we, of course, in the lead up to the 2008, leading up to the 2008 housing sort of crisis, Canada has all the same problems with interest rate manipulation that is going on in the United States, right? So technically, Canadian banks actually have no reserve ratio requirement, right? So they actually, theoretically, they can lend out. What they have is they have sort of a lending requirement. So they can have they have a leverage requirement. So they can theoretically lend out a certain amount based on what their assets are worth. Now, of course, I don't know if you know about Canadian. You may hear about Canadian house prices every once in a while. We have, of course, Vancouver on the west coast, and then we have Toronto, which is where I live, which is sort of the New York City of Canada. The home of all the banks and the financial sector. And we are currently experiencing, I would say, a housing bubble on par with any of the biggest ones that occurred in the United States. So what happened is that within the 2000s, of course, we kept our interest rate low, just like the United States did, just like the Fed did, and we've managed to now have 3-bedroom houses in downtown Toronto going for $1.5 million, let's say.
Okay.
So yeah, and apparently Vancouver's even worse. So you've got condos, $2 million condos, $3 million condos. In downtown Toronto, you have multi-million-dollar condo buildings that have half empty. Like they're basically, people have purchased them, nobody's renting them. There's tons of supply on the market, yet at the same time, we're continuing to see record high housing prices in Canada. Now, around 2007, 2008, we had a lower debt-to-income ratio within Canada than there was in the United States and the UK. But now, Canadians in general, we're now above U.S. and UK levels in terms of debt-to-income.
I want to talk about the key issue, I think, would be in a lot of people's minds thinking about Canada from a U.S. perspective, and that is your healthcare system. We hear an awful lot about this. It's vastly superior to our own. Now, our own is full of problems. Nobody denies that.
Right.
But it's being compared to yours, and that the direction that we ought to go in is in your direction. Now, first of all, Is the Canadian system a so-called single-payer system? And if so, can you explain what that is?
Yeah, so the Canadian healthcare system, or in the 1960s, late 1960s, interestingly enough, around the same time that Medicare and Medicaid was created, we came up with a socialized healthcare system, and it is a single-payer system. So what that means is that for the majority of healthcare coverage, or the majority of healthcare procedures, like when I go to the you only have one payer, right? So if I need heart surgery, the government pays for it. If I need knee surgery, the government pays for it. If I need to go to the doctor and just get a checkup, the government pays for it. There's it's just 100% covered by the government. Now, we do have certain procedures that fall outside of that, right? So if you have certain things that the medical system won't cover, right? Like laser eye surgery is sort of one of these classic ones that everybody, and a lot of people within the free market movement like to talk about something like that because it's a fairly recent system, or a fairly recent procedure that a lot of people are using, but government systems aren't covering it, and of course it's doing very well. Now, within when we have this socialized system, when we have this single-payer system, of course, the problem is that the only way that the government can control costs is through rationing. Now, understanding the Austrian School of Economics, understanding the economic calculation problem and whatnot, you can see that within our socialized system, the government doesn't really know how to allocate resources, right? So what ends up happening is that because people perceive healthcare here in Canada to be free, there's virtually an unlimited demand for it, right? So people will just go to the doctors and say, well, I need this or I need that. And so the way that the government controls the number of people who are going in for procedures and whatnot is through rationing of care. So the government actually sets the number of doctors. The government controls the number of procedures of any given type of procedure that can be done within a certain year. It sets how much the doctors can charge for each procedure, and that also even sets a cap on what doctors can charge every year. So you now have situations where you might have people sitting on waiting lists for a very long time. Maybe let's say somebody needs some knee surgery. They might wait on a waiting list for 6 months to see. They might see their doctor after a couple of weeks, and then the doctor will say, well, I'm going to refer you to this specialist. Well, the specialist has a 3-month waiting list. Then you finally see the specialist. The specialist says, well, now you need an MRI. We need to take a look at that knee. Now you've got a 6-month wait for that MRI. Then once the MRI comes back, then you got to go back to see the specialist. He makes an appointment for your surgery. Your surgery could be another 18 months, 6 months to a year down the line, right? And all this is about controlling costs because essentially the doctors act as a union, and they're always working to reduce the number of hours that they work and increase the amount of pay they have. I have a friend who I was doing some work with a little while ago, and he was mentioning to me that his doctor said to him that they were only going to work 8 months this year because they had hit their salary cap, essentially. So
wow.
we have a So we have a situation where you have we have a shortage of doctors within Canada, and people keep talking about that. My own wife, when we moved to Toronto, it took her a good long time, about a year, to even find a doctor. And that doctor explicitly said to her, you need to be young. If you're young and healthy, essentially, I'll take you on as a client, as a patient. But if you're not, I'll show you the door.
Right.
And so there's a lot of So the main issues that we have there is that people end up essentially dying on waiting lists. Now people don't like to, the Canadian press, for whatever reason, doesn't like to talk about it. I think people, there's some sort of chauvinism where we like to think that we have a far superior system to the American system. But, a lot of the same problems that happen in the United States happen here. So, say with things like chemotherapy or certain types of drugs that you might need to take. Now, there's often a story where Canadians will say, well, at least in our system, people don't go bankrupt waiting on because they can't afford their health care,
right?
Can't afford their drugs.
Yeah, So what's the answer to that? Right.
Well, yeah, exactly. What's the problem? So, of course, we have within Ontario, we have the Ontario, health insurance program, which covers, and again, it's sort of funds are distributed at the federal level, but each province, which is roughly equivalent to a state, each province actually controls healthcare distribution within its own province. So even from province to province, you can have different levels of care, right? Now, so when you have so because they want to control costs and because they ration things, the government not only is controlling the number of doctors, controlling the number of procedures, they're also controlling the types of drugs that they sell and the type of drugs that they will make available to you. So you can say, so if a brand new drug comes out and it's life-saving and it's changing, and everybody wants it, it's essential to your care, you can go to the government and the government will say, yeah, well, we don't cover that drug under our plan. Now, you can purchase private healthcare insurance, and oftentimes many people who work for large corporations or work for a company of a fairly large size will have separate plans that can cover these drugs. But we do have lots of stories of Canadians essentially having the same exact problem where they will go bankrupt because they can't cover the cost of these drugs. And, when they can't cover the cost of the drugs, they have to pay for it out of pocket. They have to sell their house. They have exactly the same issues that the Americans do. So, and then you get, and the other issue, that we end up with these crazy stories where dogs and cats will be using, now because veterinary medicine obviously isn't covered under the socialized medical system, you will have dogs and cats going and using MRIs or CAT scan machines that a human would use. Right? Because the CAT scan machines, they'll say, or an MRI, they'll say, well, you can use this machine. We've got a budget for 500 operations or 500 scans per year or something like that. So these machines will not be on at night. They might not be on the weekends or something like that. So veterinarians will use them and they will send dogs or cats there. And of course, a dog or cat, they say, well, it's not a human, so we can let it in, we can charge for it, and you can have it next day. I mean, this is the absolutely ridiculous system that we have.
All right, let me jump in here. What about people who say, look, you people who have these criticisms, you're grasping at straws. These are unfortunate aspects of the system, but this is nitpicking. For the most part, Canadians are quite happy with their system. There's not one of them, or there are very, very few of them, who would want to give it up. And no, don't poll numbers show that most people are happy with the system in Canada? And if they are, how bad can it be?
Well, I don't think that. Poll numbers. I think what happens with that. Now I'll say it right out. Is that oftentimes a lot of Canadians, they like the idea of the system and they like to have the idea that yes, this is being taken care of. But when they actually have to go and interface with the system, they come away from it having a lot of reservations with it, right? So they don't. Oftentimes, Canadians don't really realize how the system operates until they have to deal with it. Much like, and with socialization and these sorts of things, it's. I guess so. People like to have the idea that they don't have to worry about something, right? They don't have to be the one going out there and thinking, okay, do I have the right coverage? Am I going to be taken care of if I get sick? I have children, so, I can only imagine, if I had to go to the hospital and I don't have insurance and I didn't get the right kind of insurance, I get there and the child is, not being covered for something. And you can only imagine what people are thinking about. And so I think what happens is that people think that, okay, yes, it's taken care of, it's free, it's universal, it covers everybody, it's fair. But when they actually have to interact with the system, they realize that it's a real house of cards, and you will also have a situation where out in in a city like Toronto, a city like Ottawa, obviously it's a very populous place, several million people. There's lots of doctors, there's lots of specialists, there's lots of machines. But once you get out of those major urban centers, you'll have people coming. You might have somebody in Northern Ontario, in North Bay or Sault Ste. Marie, having to travel, 8 to 10 hours to get to Southern Ontario to be able to see a specialist. So, and I think that's really, really at the root cause, right? Is that people see they think that it's good that everybody's covered, or at least it's good that they think that everybody's covered, and they think that it's more caring, and it's obviously not the brutal system of the brutal system of profit and loss shouldn't be applied to something as key as healthcare. But then when they actually interact with it, a lot of people start to see the problems. But unfortunately, oftentimes it doesn't happen until they actually have to use the system.
All right, let's talk about one other issue that comes up a lot when people in the United States think about Canada and the state of freedom in Canada, and that has to do with political correctness and hate speech and issues like that. We hear horror stories coming from Canada related to this. Is this the kind of issue that varies by province? Are these federal issues? Do you know what it is that I'm talking about?
Yeah, absolutely. So what Canada has are these things called human rights tribunals, and I think that's oftentimes...
That's what it is, yeah.
Yeah. So there's a number of Canadian writers, guys like Mark Stein, who some of your listeners may have heard of that person. There's another writer named Kathy Shadle, another guy named Ezra Levant, who are often, they're sort of more on the conservative side of things. But they're often just pointing out legitimate issues or something like that. But, and they're often pointing out just legitimate issues, but, what'll happen is that somebody will decide that, well, that insults my religion, or that insults my belief system, or that insults my, my personal choice about my sexuality, or these sorts of issues, and they'll say, well, that violates my human rights. Now, what I call these things are the council. I think it's the council of hurt feelings or something like that. So you might have a situation, and now it's come to the point where a comedian in a club in British Columbia was making a comedian club in British Columbia was dealing with some hecklers. And they slapped him with a human rights suit. So this comedian was fined thousands of dollars for essentially dealing with hecklers in a comedy club. And it also becomes laughable. Somebody in British Columbia felt that they needed to wear combat boots into a gym. And so the gym said, well, no, you can't wear combat boots into this place. And you can't wear combat boots into this place. And they sued them. And they said, well, this is my human right to be able to wear combat boots into this place where you can work out. And what does happen with these hate speech laws and these human rights tribunals and these sorts of things, they do act essentially to try. It's a way for the government to try to, as far as I've seen it, as to essentially try to stifle speech that they don't deem to be politically correct. Right. So I was talking to Kathy Shadle about this, and she said that, if a Catholic group or a Christian group had the same complaints and went to one of these human rights tribunals, they would just sort of laugh them out of there and just say, well, what are you talking about? This isn't an issue. But when certain protected groups or politically favored groups go in there and complain, well, then they deal with it.
All right, I had to get that off my chest, so I'm glad you covered that. But I want to talk about you, actually, and your background. If somebody looked at your educational background, he would not think this guy is going to go on to found the Mises Institute of Canada. So tell us about your life. How did you get to this point?
Yeah, so what happened was, it's funny. I often say that I didn't have the experience to work at a think tank, so I had to start my own. I actually studied fine art here in Toronto, painting and drawing and these sorts of things. But at the same time, I was always very much a student of history. I was reading lots of books. I grew up in Ottawa, so it's sort of the place where it's just politics all the time. So you can't help but notice these things, the different laws and economic policies, free trade, this, that, and the other thing. And of course, my father lived in the United States for a time, so I would travel specifically outside of Washington, D.C. He was a diplomat. So I would travel back and forth between Washington, D.C. and Canada and watch all these political shows. So I had a great interest in history and economics, philosophy and law, and so I was just reading a lot. I think it was around the year 2000 that I decided to, I guess a lot of people like Naomi Klein were complaining about, capitalism and free trade and international trade being the root of all evil, essentially. So I wanted to know more about it. Of course, at that time, the internet was just beginning. It was hard to find things like the Mises Institute down in Auburn, Alabama. So I picked up Adam Smith's Wealth of Nations and started my economic education there. Because oftentimes, if anybody, the common person may have actually heard about the Invisible Hand or Adam Smith being the founder of capitalism. So I started my education there, and then I was working after I got out of school, I was working within the lighting industry. So this was residential lighting. We were designing it in Canada, manufacturing it in China, and then distributing across Canada and the United States. So, of course, this was a proxy for the housing market. So as I got to see the whole housing bubble from the inside. And so I would get these stories from China. They would say, okay, we're running out of fuel, we're running out of electricity, just everything's going gangbusters. Yeah, sorry, those lights that you wanted to buy, well, we've got to increase the price of them because the price of zinc just tripled within the last 2 months. And I would go down to Dallas, Texas, where all the showrooms happen to be. Within the United States for lighting companies. And all the lighting companies down there were saying, we need bigger space, we need to expand the showroom, and we need bigger space, we need to expand the showroom, and if you don't do it, we're going to go to Las Vegas. Now, if you listen to Doug French and his stories about the Las Vegas housing market and the housing bubble there, you'll understand what was going on. So they expanded their showrooms, and all this extra space, filled them with lights, just in time for the housing bubble to happen, or the housing crash to happen, and you would go down there. It was like a ghost town. So I got to witness, sort of from the inside, the housing boom, the boom and bust. Now, when that all happened, I started looking for answers, of course. I was trying to find out, okay, what's causing these things? I mean, this could greatly affect my life. Look at my own house. What's going to happen with house prices in Canada? And as I was searching, I found sort of a blogger, and again, the beauty of the internet. I found a blogger who was essentially a self-taught Austrian scholar, and he was linking to the Mises Institute in Auburn, Alabama. I started reading that, and once I read this stuff, I realized that I'd been an Austrian economist, or an Austrian my whole life, and didn't even know it. It just spoke volumes. It just spoke a lot of truth to me. I started reading about the business cycle and examining what was happening within my own industry, and was like, wow, well, this is actually what happened to me, to my industry. I looked at interest rates, I looked at inflation, I could see through international trade, how, the central bank was inflating, house prices were being, pushed up. Then that inflation would filter through all of the first, like, say, the base metals, like the zincs and the coppers. That price would be incorporated into the price of our lights. 6 months down the line, our lights would get to market. This inflation would be baked in, and all sort of came together. And then I think it was. I sort of wanted to change in my career. I wanted to move into a different world, more the world of ideas and whatnot. And so I decided, I sort of reached out to, and I felt like a real passion for the Austrian School for Economics and for getting these ideas out there, because I think it's so important, that I sort of reached out to Jeffrey Tucker and Doug French, who at the time were with the Mises Institute in Auburn, and I had noticed that there were all these other Mises Institutes around the world sort of starting up. There was Mises Brazil, there's Mises Institutes in the Czech Republic, in Poland, in Germany, Lithuania, Estonia, Sweden. And I guess I decided to launch Mises Canada. And I guess the rest is history. It sort of has been going very well since then.
What does Mises Canada do? It's presumably analogous to the Mises Institute in the U.S. This is a question I already know the answer to, of course, but how can I not ask it, right? So just tell us about, a better way of putting it would be, tell us about Mises Canada. What do you guys do there? You guys do have some special events, and you do have a very active website, because I know Bob Murphy writes for you very regularly, and he appears on this program very regularly.
Mm-hmm. Yeah, so obviously, I was greatly inspired, by the work that Lou Rockwell did in launching Mises Institute in Auburn, Alabama. I think it's really important because obviously the ideas that we support, the Austrian School of Economics, we all know that the mainstream economists, the mainstream media, the central banks, all these sorts of things, they're not interested in these ideas because they know perfectly well. I think sometimes that they know, these central banks, they know perfectly well what they're doing. They know what damage the increasing money supply will do to the economy, but they just don't want to deal with the ramifications of that. So, the more that these ideas spread around the world, I think the better it is we're all going to be. So, to that end, Mises Canada, we have several events that we've launched. Our first event that we started doing was the Toronto Austrian Scholars Conference. So that sort of mirrors. It's a general scholars conference that's open. Obviously, we focus on the Mises on the Austrian School of Economics. I think it's probably one of the few. One of the few in the world now. I think the Scholars Conference in Auburn was the first one. There's one in Brazil now, I know. There's maybe a few other, but I think the Toronto Austrian Scholars Conference was, one of the first ones, one of the first other ones in North America focused on the Austrian School of Economics. So we're now into our third year of that. We've rebranded it the International Conference of Prices and Markets to go along with the academic journal that we've also launched, and you can find out more about that at pricesandmarkets.org. So that's going to be happening November 8th. So far, we've got about 20 participants, 20 papers being presented, people from around the world as well, people coming up from Grove. In fact, Jeffrey Herbner will be attending. Sean Reichenauer will be attending from Grove City.
Great.
Yeah, Grove City, Pennsylvania. And I guess the other event that we just launched, and we ran it just this summer, was Rothbard University. So this is expanding. We sort of took what Lou Rockwell started with Mises University at the Mises Institute in Auburn, and we started our own here in Toronto, and we called it Rothbard University. We had Walter Block here teaching. We had Dave Howden, Doug French, Glenn Fox. So we had 3 days, about 50 students. It was a great success, and we're going to be running that every year. Now, we're focused on Canadian students, but it's open to everybody. And we find that especially a lot of young people now, kids who are sort of like 18, 19, 20, they live through the whole they lived through the housing bubble, the crash, the 9/11, the expansion of empire, the wars, all this stuff, and they're starting to look for answers, because like in the United States, here in Canada, kids are getting out of school, and there aren't the jobs. We have massive oversupply of people coming out of teachers' college. We sort of are having these problems with structural unemployment. They look out, somebody, might get married at 25 or 26, go to buy your first house, and all of a sudden that starter home that 10 years ago, 15 years ago, was going to cost you maybe $175,000 in Toronto, now is costing you $500,000, $600,000, $700,000. And, they realize something's up, something's going wrong. They can't start their lives, and what are they going to do? So they're looking for answers, and for whatever reason, I think that some people seem to think that, unlike the law of gravity, certain laws of economics function differently in different countries. So in some ways, it's essential to have these institutes around the world so that they can speak to the general populace and talk to specifically the problems. We have specific problems to deal with, with our socialized healthcare system. That, say, the United States doesn't have those same problems. So we need to be able to speak to Canadians about these things and to speak to the young, to the students, so they can, hopefully make a better future. And that's really the reason why I started Mises Canada.
Well, the website is Mises.ca. That's MISES.ca. Redmond, of course, you already know the importance of the work you're doing. Nobody was doing it until you did it, so we can see how truly indispensable it is. And the people you have associated with you are top-notch. You've got Bob writing regularly, but David Howden, who, of course, is from Canada, is absolutely, I think he's one of the I mean, in a way, it's an insult to him to say he's up and coming. I think he's already arrived. He's a tremendously creative scholar with all kinds of fresh and interesting ideas and applications in the Austrian school, and to have him as part of your project is a real coup for you guys. But best of luck with it. I want to urge people to check it out. Even if you're not in Canada, there's a lot of great stuff you're going to find interesting at Mises.ca. Thanks so much for being with us today.
Absolutely, and just so people know, if you check out Rothbard University on YouTube, you can now see all the videos. They're online from our conference that was just this summer. And thanks again for having me on, Tom. Your work has been a real inspiration to me as well. And I'll let you know that oftentimes when I ask people who we'd like to have come up here and speak in Canada, oftentimes your name is one of the first.
Well, I appreciate that.
Yeah, of course, Bob and his karaoke is oftentimes.
Well, that comes up too. Right. Well, again, thanks a lot, and I hope people do check out those videos on YouTube and check you guys out at Mises.ca. Thanks again.
Okay, thanks again, Tom.
All right, everybody, that was Redmond Weissenberger. Check out Mises.ca, MISES.ca. And remember, you guys can get the Tom Woods bag of goodies if you support the show. What's in that bag of goodies? It depends on which bag you choose. Here's one of the bags. You can get my government course for the Ron Paul homeschool program, which is 90 audio files, also video, but probably on the go. You want to listen in audio. 180 video and audio files for Western Civilization Part 1. All kinds of topics you wish you knew more about. Now you can learn them from me, so you can sort of trust them. Then you're going to get our forthcoming 31-lecture course, What's Wrong with Textbook Economics, where we're going to go through a mainstream economics textbook, chapter by chapter, and do an Austrian critique. Then I'm preparing exclusive mini-courses just for you supporting listeners. I got 2 of them up already on interesting topics. You get the Kindle version of my forthcoming book, Real Dissent, A Libertarian Sets Fire to the Index Card of Allowable Opinion. You get discounts on all sorts of Liberty retailers. You get transcripts of all the interviews. Some of you guys will be getting signed copies of actual hard copy books of mine. And if you get the super duper duper bag of goodies, you get a subscription to my libertyclassroom.com. You get a lifetime subscription. It's just unbelievable. How do you get the bag of goodies? You go over to supportinglisteners.com. Make sure and check me out in New York City, October 11th. It's going to be great. Liberty Fest, LFNYC.com for details on that. Tomorrow on this show, it's Scott Horton, back by popular demand. Scott Horton is going to tell us what's really going on with ISIS and Obama and all this stuff we're hearing in the news. Scott's going to make sense of it for you. That's tomorrow. Don't miss it. See you then.
The Tom Woods Show.